This is the third tool, or the third part that's used in a person-centered review. The health and behavioral consists of questions related to medications, medical personnel, who your doctors are, hospitalizations, equipment that you might use, behavioral needs if you happen to have them. The intention is we use a questionnaire that was designed by our nurse, Linda Tupper, that asks questions to get at the heart of how well is this person supported medically.
I have a question.
Yes.
These are a lot of personal questions. Why do you need to know all this personal information anyway?
Yes. The question is, why are we asking so many personal questions? Our health questionnaire really goes into quite a bit of detail, right down to the exact doctors that you're seeing, what medications you take, have you had this exam, an eye exam, have you been to all sorts of doctors. The reason we ask the personal questions is in order to really get a clear understanding on your medical and your understanding of your health. One of the things that was at a foundation or the center point of the contract in quality assurance is assuring health and safety for people with disabilities. In order for us to assess health and safety, it involves us having to ask personal questions. It helps to understand for us what doctors are you seeing, who's prescribing your medication. By having the nurse look at this information and reviewers ask these questions, we can sometimes point out areas or points for follow-up. Perhaps you haven't been to a dentist in the past 12 months and we're identifying that you're having difficulty finding dental. Maybe some of your medications are prescribed by a regular doctor when they need to be prescribed by a neurologist. If medications aren't prescribed by doctors that need to, they might not have the same understanding or understand their side effects or their concerns. So all these questions that we ask, at any point, you can decline to answer any one of the questions. At any point, whether you participate in the review process, but if you decide not to answer a question or two, that is absolutely your right. But our ability to gather this information really gives us a well-rounded picture of the person and allows us maybe sometimes to make some suggestions or point areas for follow-up for your team of supports.
Well, I do have another question. The person that I support does not use words to speak, to communicate. So how are you going to get all these questions answered?
Yep, and that's a very good question, is how do we get questions answered when the person doesn't use words? That is one of the reasons when we're scheduling a person-centered review and we're talking with the support coordinator, we ask a lot of questions ahead of time. We try to get an information about who does the person live with, what's their communication style, who knows them best. When scheduling a person-centered review, the coordinator is going to help us determine who else needs to be there for that PCR. At the time when we're gathering questions regarding to the health of the person, if the individual for any reason is unable to provide information directly to us, with their permission, there are people who know them best. Maybe it's staff in the group home where they live, it could be their parent or a sibling who can help provide information on their behalf. When asking questions in a health and behavioral assessment, the reviewer absolutely will gather information from as many people who knows the person and use that information to answer the questions as accurately as possible. Ultimately, with the health and behavioral, every review that Delmarva does, our nurse Linda Tupper reviews every single questionnaire that goes through. Based on questions answered, if there's certain red flags, the questionnaire is designed in such a way to highlight if there are red flags. For example, we might note that the person's lost a lot of weight, we're seeing an increase in emergency room visits, and there's been lots of changes in their medication. That might indicate that there's some need for some additional medical follow-up. Linda Tupper, who's the registered nurse with Delmarva and our nurse reviewer, at that point in time could get with the area nurse case manager in that given area and suggest maybe a medical follow-up or health and safety staffing. We also have the ability to get with our medical director, Dr. Braun, who can do a follow-up to a review, and we can also do a focused review, which kind of takes us a little bit step further besides the questionnaire, in which we actually look at some medical claims, see what doctors and medications the person's taking, and if needed, refer out to a specialist maybe for their input. The majority of the person-centered reviews, really the information that we collect stays at the area level and is provided for information and follow-up, possibly for the support coordinator as one of the person who leads their team of supports to address those concerns. As part of a person-centered review, we oftentimes are traveling to either a person's group home, maybe out to their adult day training where they're attending, where they're receiving services. Either way, ADTs in residential facilities, which would be licensed group homes, these could be group homes licensed through the Agency for Persons with Disabilities, ALFs, licensed foster homes, any of these are considered service sites. And when I mean service sites, it means that Delmarva will conduct an observation of any of these sites that are around the state. We have an observation review checklist that's also available online and is one of the handouts. It is used as a guide and a reporting mechanism for the quality assurance reviewer to document any concerns or issues related to the person's environment or how services are being rendered. Yes?
So what kinds of things are you looking for in this? And are you only observing, or will you be speaking to people?
Well, typically, those are good questions. Are we just observing? Are we talking to people? And what are we looking for? First, to understand how observations work within the review process. If you're a provider and you have adult day training, all your adult day training sites will be observed during your provider discovery review, meaning the reviewer will have to go out to each of the sites and do an observation. If you're a provider who has group homes, residential rehabilitation homes, and you provide services through people through that means, there are some large providers in the state who have upwards of 15 or 30 group homes. Delmarva will do 10 of the group homes up to 10 of the homes that a provider has. If you have less than 10, we'll be going out and doing observations with all your homes. Over 10, we'll do 10, and then on the next review year, we'll be able to cycle in any of the group homes that we may have missed. The reviewers will intentionally set up a time to go out to these sites when people are there. Oftentimes, providers try to help us out and want to schedule these group homes, these observations, when they say things are quiet and want us to go out to the home when everyone's off at work. Ideally, for us to get an idea how well a home is run, what the environment is like, if it's working for people, we need to see people there. So to answer the question is yes, as we walk through the home, we may chat or have conversations informally with people who are living in the home. Oftentimes, reviewers will ask for one of the residents in a group home perhaps to show them around the home. At the same time, we are observing. We don't want anyone to change their routine. We're not asking anybody to stop or do anything different. We really just want to observe and kind of see what that home environment is like. Perhaps we're out there at dinner time and everyone's getting ready for a meal. At that point, we could be looking at if there's any programs being rendered through residential rehabilitation. We're looking at basic things, smoke detectors around the home, windows, entryways. Can people get in and out? Do people in the home seem to have free access around the home? Medications, are medications locked and stored away in a safe place? If we happen to be out at the home when medications are being administered, that might be something that we would observe while we're doing that observation. The key part is with the observation review checklist is if something wasn't observed at the time that the reviewer was out there, or if it's not something that they can make any determination on, the reviewer can score that as NA, not applicable, at least for that particular observation. As I said, these sites are arranged and scheduled between the QAR, the quality assurance reviewer, and the provider. So again, we would go out to each adult day training. Again, in ADT, we would go out there when everyone's out there. Oftentimes during the day, most ADTs are run between 9 a.m. and 2 p.m. So we'll be out there. We want to see how folks are working in their program, get an idea, talking with individuals receiving services. Observations really are meant to kind of just take place in the background, really not disrupt people. If we're taking a tour or walking around someone's homes, we're not going to be walking into someone's private bedroom without their permission or having them show us around. Oftentimes, the things that are most often identified might have to do with safety issues, things with smoke detectors. Are you prepared in the event that there's a hurricane? Again, are medications kept safely? Are people treated with respect? What's the attitude or the relationship between the residents in a group home or the people attending an ADT and their staff? So any of these things could be used to gather information for an observation. At this point in time, I'm going to turn it over to Kristen Allen, who will take you through the provider discovery review.
Thank you, Teresa. Hello, everyone. My name is Kristen Allen, and I'm also one of the regional managers with Delmarva. My primary role, just as Teresa's primary role, was with the person-centered review process. I am the primary lead for the provider discovery review process, which we refer to as the PDR most often. It's what most providers are more familiar with the term of annual review. Most of the time, that's what you're thinking of when you think about the provider discovery review. What it is that we're looking at you as a provider, how you're providing services to people that you're serving, and also we're gearing it towards its service delivery measures and requirements per the handbook. There are primarily three main components, and the next few slides are dedicated to this portion of the presentation where we're talking about organizational and administrative practices, individual sample of record reviews, and the sample of individual record reviews. There's a number of things that these questions will lead you into. I haven't had any grievance procedures. Why do I have to have a log? We'll talk about that when that's something that's involved in policies and procedures. We'll go into how many files the staff are going to want to review in a couple of minutes, and we'll